Come on, give me a break. Yes, finally. Yeah, it's out. Thank God. So, there is a hip, right hip joint here. It's a 66-year-old female patient. I'm downloading it already. Just gonna grab a template because there is a template right here for a hip. Old woman, hip, can't be good, probably arthrosis or a fracture. Let's see what it says here on the... I'm out of coffee. Gotta get more coffee. It says labrum lesion and arthrosis. Of course, why not? Let's just load it up and see what we got. So they did a coronal with a large field of view, which makes no sense. This is just a waste of time. There is a clear major trochanteric bursitis right there. There is even a collection of fluid. It's bilateral, but it's clearly much more prominent on the right side. This is by itself already painful enough for this patient to get an MRI. This is so low resolution, I can't tell much, but they did a proper scan. So there is at least a degenerative process right there on the anterior superior labrum, which is quite common. Can't tell if there is a rupture there. There is a rupture right there, I suppose. Just going to look for that on other planes. Also, there is tendinitis of the minor gluteal tendon. The middle gluteal tendon is fine. The minor is inflamed. The gluteal medium is gluteal menor, gluteal medio, and gluteal maximus. So this is minor, this is medium, and this is maximus. So there is edema and a small fluid collection right there. There isn't much of arthrosis to say. And let's grab a T1. That is clear hypertrophy and fat substitution, fat infiltration. Maybe some tiny osteophytes right there, nothing much. Yep, nothing much. No arthrosis. No real arthrosis, just this. Yes, this is something to look for. That is tough to tell. Really tough. Can't really say because they make this. They make the slices so thick, but so thick you can't really tell much because it's like too thick to properly image. See, the tear could be here, but it goes over it so fast it barely shows in one slice, so it's really difficult to tell anything. I just can't tell it. I'm going to say it's degenerative of some sort, just to be certain. There is indeed maybe a labrum lesion right there, which is unfortunately as much as I can get from this quality of exam. There is at least a moderate tendinitis of the minor gluteal tendon right there, and nothing much from the middle or medium gluteus tendon right there. Ischiotibial tendons are fine. No narrowing of the space right there, the ischiofemoral space, which could tell us This could be a posterior hip impingement. No signs of posterior hip impingement. Iliopsoas tendon is fine. And right there, the nerve, sciatic nerve is okie dokie. The piriform muscle isn't of concern, so no piriform syndrome. All the anterior muscles seem fine. Anterior, inferior iliac spine is fine. So we have tendinosis and of course a bursitis, a major trochanteric bursitis. Clear diagnosis, easy to make right there. So let's go for a degenerative signs of degenerative disease of the anterior superior labrum, acetabular labrum, which means it doesn't mean much, but this is as much as I can tell because this exam is too thick, has two slices, too thick slices, way too thick. The slices are way too thick. We have muscle hypertrophy and fat infiltration right there. And of course we have bursitis and a moderate tendinitis